So I'm going to switch gears a little bit and talk about cancer in Africa, because cancer in Africa is almost always a death sentence. Cancer is on the rise in Africa, and infectious diseases are on the decline. But cancer kills 60% more Africans every year compared to malaria. African women are impacted with more aggressive tumor types in breast cancer, and they're younger when they are diagnosed with breast cancer. African men are disproportionately impacted by prostate cancer, and they have poor outcomes. Cervical cancer is 40% higher in Africa compared to the United States, and liver cancer is 50% higher. But I'm excited to be here with you today to tell you about a program that BioVentures for Global Health has launched, the African Access Initiative, in partnership with leading pharmaceutical companies, Takeda Pharmaceuticals, and Pfizer. We're also working with 5 African ministries of health, including Nigeria, Kenya, Cote d'Ivoire, Cameroon, and Rwanda. And we've brought on 35 cancer hospitals across those 5 countries. We've implemented comprehensive needs assessments and questionnaires across those hospitals, and we're using the data in those needs assessments to understand how patients are currently being treated, but most importantly, what are the gaps and what are the priorities to improve patient outcomes at those hospitals. Just 1 week ago today, I was in Abuja, Nigeria, with the Honorable Minister of Health, an oncologist, Professor Isaac Adewale, and we brought together the oncology teams from 8 leading cancer centers across Nigeria to look at the data that we're generating through those needs assessments and to agree on a plan to move forward to improve patient treatment at those hospitals. We've found in the needs assessments that the top priorities are access to safe, affordable, and high-quality cancer medicines, also diagnostic technologies. Clinical trials in African populations is a very high priority, and pediatric cancer was another area that the oncology teams wanted to prioritize. So we've increased our commitment in Nigeria, and we've also doubled our commitment in our other 4 countries to bring our partners together around providing what they need to not only double the progress on cancer, but in Africa, we can quadruple the progress if we come together and we help African countries come up to the same level where we are today. And so I'm reaching out to you as cancer advocates and organizations to partner with us to help to speed and accelerate the rate of progress of cancer treatment in Africa. Thank you.